is Lakeisha Edwards Wilson, and I'm one of the BRYT Family Engagement Coordinators. BRYT stands for Bridge to Resilient Youth in Transition, which is an organization out of Brookline Center for Mental Health in Brookline, Massachusetts. BRYT Family Engagement Coordinators work with families across New England, facilitating monthly parent conversation, providing resources to schools that will assist and support families with needs. BRYT helps schools build and maintain high quality Tier 3 general education support programs for students struggling with mental health and other significant medical issues. There are over approximately 150 BRYT programs in elementary schools, middle schools, and high schools in Massachusetts, with several other programs launching in New Hampshire, New York, Oregon, Illinois, and more across the county. Now I will have my counterpart, Victor, introduce himself for tonight.
Hi, thank you so much, Lakeisha. I'm Victor. I'm also one of the Bright coordinators. I've been with Bright for a while, and it's great to always to do these live broadcasts and have these wonderful guests. We are so grateful Nicole join us this evening. Nicole is an assistant professor of social work at the Westfield State University in Massachusetts, where she teaches advanced adult and family clinical social work courses, as well as courses on diversity and social justice and social welfare policies analysis and school social work. As a licensed clinical in California and Massachusetts, Nicole has provided consultations to school districts about student mental health, suicide risk assessments, and prevention. And she has provided consultations to community-based organizations on issues of race, equity, and inclusion. Nicole has worked in outpatient adult adolescent communities and mental health settings and managed children and outpatient mental health treatment facilities. Oversaw district-wide mental health services delivering for K to 12 students, and currently providing clinical consultation and supervision and training on mental health. And boy, do we need all of that right now, Nicole. We're so glad you're around and you exist and you're doing this important work.
Thank you. Thank you so much, Victor, and thank you. Lakeisha, can you hear me okay before I get started?
Yes.
Okay, wonderful, wonderful. Well, it is my pleasure to be here this evening to talk about this particular subject. What I'm going to be sort of expanding a little bit of the topic that I was asked to speak on. I'm going to expand it a little bit because it is such an important topic, and this is a very critical time for a lot of BIPOC children and families. And so what I'm going to be speaking to today is really how we can help BIPOC families navigate systems, because systems are very, very complex, but how we can help support BIPOC families navigating systems on behalf of their children. Okay. And so I want to start off by saying, as you all have already heard, I am a licensed marriage family therapist. I'm also a licensed independent clinical social worker, both in California and in Massachusetts. And so in addition to being a professor of social work, a licensed clinician of social work, I also happen to be a parent. And in addition to being a parent, I'm also a former foster parent. I'm also a person who has worked in schools. I'm a person who has worked in a variety of community mental health organizations, as well as other social service organizations. So I am very familiar and I understand the challenges that are involved in navigating through the many systems that parents might need to engage with on behalf of their children, on behalf of themselves, and how quite understandably navigating systems can sometimes feel quite overwhelming. And so I want to start off by saying, really putting the question out there, what is a system? When we're talking about navigating systems, what am I talking about? So what I'm talking about is a system being a range of public and or private organizations, institutions, and agencies that are designed to provide support and assistance for particular groups of people with needs. Okay, so I'll give you some examples. Some of these systems include healthcare systems that can be hospitals or medical clinics, educational systems, which we typically think of as being schools. There's the child welfare system, where depending upon where you live, it might be called DCF. I'm from California originally. It's called CPS, Child Protective Services. We're talking about the mental health service system. We're talking about general social services that are available to people. We're talking about juvenile justice systems and more and more and more. Our society is made up of systems. And so one of the things that's important for us to remember was that although these systems were built, they were designed to provide services to people who have needs. Typically and traditionally, these services were not designed to address the unique needs that many BIPOC people and families face. In other words, these systems were not designed for us in particular in mind. And so unfortunately, more often than not, these organizations, which are oftentimes quite bureaucratic in nature, meaning that the organization can unfortunately be more invested in sustaining itself than being able to adequately offer the help and the resources to the people that the organization is designed to support. That is why many, many people are frequently talking about how incredibly frustrated they are trying to navigate systems, trying to get help, and hitting roadblocks at every turn. Another thing to remember is that we're now in 2025, and what most of us know is that life over the years has become increasingly complex. Life changed for all of us in 2020 with the COVID-19 pandemic. But even without that, life has become increasingly stressful and at times can feel very much overwhelming. And so with all of the things that parents themselves are facing in their own lives, while trying to raise their children, while trying to bring in money to be able to manage household expenses, childcare expenses, all of those things, trying to ensure that their children are educated, trying to support and raise healthy children who can manage in a society on their own one day, while prices continue to skyrocket. I don't know how many of you have seen the price of eggs lately, but I was shocked the last time I went to the grocery store. I've never seen this in my lifetime. And all of this, plus the stressors and the anxiety that for many, many people are at an all-time high. These things are very, very challenging. And so for many people, and many parents in particular, daily living can oftentimes feel quite overwhelming. I want to give you some data about this. I did a little bit of research and I found that according to current estimates, the cost of raising one child from birth to age 18 in 2025 is estimated to be around $375,000 on average, and that is for a middle income family. Of course, costs vary depending upon location, but they generally fall between $230,000 to up to $500,000 for one child. And on average, parents can spend approximately $20,000 to $25,000 a year on average to raise one child. So these factors include thinking about costs for housing, food, childcare. If you're fortunate enough to be able to have the money for extracurricular activities for your child, healthcare costs and expenses, transportation, clothing, education, et cetera, et cetera, et cetera. Okay, that's a lot of money. And so for me, when I think about my role as a parent and as a former foster parent, one of the things that I know for sure is that in the process of raising a child, right, up to the age of 18, parents will need to come into some type of regular contact with a variety of systems where they, meaning the parents and the children, may need some type of support navigating these systems along the way. So over the course of my professional career, and I've been employed by several of these types of organizations and systems, I was an insider. Being an insider, I absolutely had some advantages of learning systems from the inside, knowing people on the inside who could help me whenever I got stuck in these systems. But I also understand that navigating through many of these systems that parents will need to engage with on behalf of their children or their families can be incredibly stressful. It can be oftentimes overwhelming. And how many of us have been trying to reach out to systems and have ended up on a phone call on hold for however long, right? And sometimes just getting too frustrated, we just hang up because it's just too much. We don't have time like that. So one thing that has helped me as a parent is to remember that as a Black mother, these systems were set up to help different categories of people based upon need, but not necessarily set up for the unique needs that I had or that my children had or that my family had. They were not set up directly for me. And so if I was going to get anywhere, I had to do some work to navigate, to learn how do I navigate these systems that are oftentimes very complex. You don't know anything. You don't know anybody necessarily on the inside. And so I was going to have to learn strategies that would get the attention of the right people who were on the inside or at least affiliated with these systems that could help me be able to get my needs met or the needs met of my children. And I can tell you that is no easy feat. There is nothing easy or simple about that. So before talking about ways that I did this or approaches that I found helpful, I want to start with a little bit about who I am, because those of you that might be watching this video, I'm having a very clear understanding that we're all coming from different places. We're coming with different backgrounds, different knowledge, different skills, different levels of information. And so we are all not starting on an equal or level playing field. And so I want to start off by just saying I want to own the privilege that I had as a parent. I was a middle-class parent. I was a parent that had a college degree, who worked as a social worker. I also had access to information, people, and resources that many parents do not have. And even with those privileges, I found that I too experienced so much difficulty trying to navigate systems that were often tangled webs of confusion. I found myself being on hold sometimes for hours, having to deal with overworked, stressed out, underpaid employees who were tired. They were tired themselves because of all that they were dealing with being on the inside. And so unfortunately, that made my experience trying to advocate for my children within these systems overwhelmingly frustrating, sometimes even maddening at times. There have been many phone calls that ended with me in tears or simply just hanging up the phone out of frustration. And so, given that this was my personal experience, I just want to share some tips and recommendations that over the years I have felt have really helped to serve me. So again, I have raised 4 children, and each one of them were a former foster youth that came into my home with extreme traumatic exposure. Some of these children had learning disabilities, some had health challenges, all of them had sleep difficulties, a few had bedwetting, mental health diagnoses, academic and social challenges, and more. And so some of them exhibited really extreme behaviors. Some were on psychiatric medications, and 3 out of the 4 spent lengthy parts of their childhoods in outpatient therapy. Each one of these children identified as Black. And as we know, not only the high rates of children who are Black identified who end up in foster care systems, but also then having to deal with the bureaucracy of systems, they can be particularly challenging for BIPOC children as well as BIPOC adults. And so these systems, which unfortunately often perpetuate inequality and can perpetuate marginalization and can create barriers to accessing the support that parents need or that children's need, as well as the resources that families need in order to be able to thrive, to thrive socially, to thrive emotionally, to thrive academically. We oftentimes rely upon these resources and these systems to be able to provide the resources that we need to support our children and families. And so there are strategies that can help BIPOC parents advocate for their children and create meaningful partnerships with these systems, whether it's with schools, whether it's with hospitals, whether it's with mental health or social service organizations. It can better ensure that parents are able to ensure that their children's needs are being met. And so I'm going to start off by saying here are several steps that BIPOC parents can take to better support and advocate for their children's needs. So again, BIPOC, Black, Indigenous, people of color, okay? What we're talking about are systems that were not designed and set up for the unique needs of BIPOC children and families. I'm going to start by, when I talk about these different things, just know that I'm going to be keeping in mind and prioritizing in terms of systems, the educational systems, as well as mental health systems, okay? So let's start with what can families do and what do parents need to know? The first one I'm going to start with is, how do you build knowledge? How do you gather information about the systems that you need to access? Okay? Gathering information, building knowledge of the systems that you need to access. So one of the things that's going to be very helpful for you to know as a parent is, what are your child's specific needs from this resource? What are you looking for? Okay, so let's say in this example that we're talking about a school. Okay, you're trying to navigate a school system on behalf of your child. What are your child's specific needs from this school? What are you looking for? Okay. Then, do you have a relationship with anyone at the school? Have you had a meeting? Have you met with whoever the child's school leader or school principal is? Have you met your child's teacher? Have you developed a relationship with your child's teacher? Does this school have a school counselor? Have you met the school counselor? Have you been able to develop a relationship with your school counselor? Does your child have a relationship, ever met with their school counselor? Does your child have a relationship with their teacher? Okay, these are all the beginnings. These are the foundation, because I will promise you this: if there is a relationship, particularly a positive relationship or even a neutral relationship, those can oftentimes be significantly more helpful than when there is no relationship or a strained and negative relationship. So being able to really think about, what sort of relationship does my child have? What sort of relationship do I have with these entities can really go a long way in helping to navigate the inside of these systems. You also can be what can be very beneficial is, do parents know other parents who are being challenged by the same or the similar situation as your child? And if so, what have they done? Okay. Oftentimes schools, particularly public schools, will have groups for parents, whether it's the PTA or the PTSA, where parents can go and meet other parents who also oftentimes have relationships with people on the inside. It's also a place to go to ask these parents, who are the helpers? Okay? People will always need help from school personnel. Who helped you? Okay. Who seems eager and motivated to help? Those are the people that you want to turn to. Okay. Find them. It also can be very important to know who is in charge. Remember, just because a school might have a principal or a vice principal or a head teacher does not mean that that person is in charge. They might be the formal leader, but they may not be the informal. There are always informal leaders within organizations. Find those people, and other parents can help you identify who those people are. Also, if your child is receiving special education services, does your child have or need an IEP? Does your child have or need a 504 plan or other services? Is your child at the beginning of a process where they just need to be assessed? Knowing those kinds of things, like who is in charge, who can I turn to, can be very helpful to also know the chain of command in a public school district, from being on the ground at your child's school all the way up the chain to whether it's the principal in a particular school, all the way up to the superintendent's office and everyone in between. To know what they do, what their roles are, and also to find out, does your child's particular school district have a phone number or an email that are designed for parents to call or email when they have questions, if the child is experiencing some difficulty in school. Oftentimes, school districts will have a resource within the district for parents who need additional supports. So see if your child's school district has that and reach out to them. It can be very, very helpful in helping parents navigate the complexities of school systems, school districts. Okay. Also, in terms of thinking about from the point of a parent, it's so important for you to be able to know and understand your rights and responsibilities as a parent in relation to the school's rights and responsibilities for your child, okay? They have a charge. And if they are not living up to that charge and they're not living up to those expectations, then as a parent, you have a right to get involved and to do the best that you can to try to ensure that this school system is doing what it is supposed to be doing for all children, but most importantly, for your child, okay? One of the things that you can do is you can familiarize yourself with both federal and state educational policies that are designed to protect your child's rights. If your child needs special education services, your child will be protected by those rights. If your child needs language assistant programs, anti-discrimination, anti-bullying, whatever your child might be experiencing, there are laws on the books to protect children, right? And also your knowledge of all of the sorts of protections that in your particular state offers you and offers your child when it comes to their education, that knowledge is going to be crucial in helping you to protect and advocate for your child. Next is, how do you stay informed about school policies? These are the things that a lot of parents just oftentimes feel like they're too busy. They're too busy. They don't have time to dig into the weeds of these kinds of details. But one of the things that you can do, most schools, when school begins, there is a student handbook. There are policies, there are rules, there are expectations for student behaviors and student conduct. At the beginning of school year, you can speak to your child about that. Help them understand what is expected so that they can at least go to school informed about the expectations of the school. You can also regularly check for updates from the school or from the school district, as well if there have been any changes in laws or policies that could affect your child's education. And we want to make sure that schools are able to provide an environment where every single child has the ability and the opportunity to access the education that is there for them. The other thing is, and to the best of your ability as a parent, it's how are you, I'm going back to this piece around the significance of developing relationships with your child's school, who can also serve the people who are there, who can serve as an advocate for you and for your child. In order to facilitate those relationships, my recommendation would be, as soon as possible, engage early and as often as you possibly can. You want the teachers, you want the administrators to know your child and to know you, that you are a person who is going to show up, that you are going to advocate for your child, that you are going to invest in building relationships with the school, with your child's teachers, with the counselors, with the school administrators. If possible, you're going to be able to show up to the parent-teacher conferences, any other open houses, any other school events, so that these people know that you are an active and invested parent. Understandably, not every parent can do that. Parents are working, parents are busy, parents are tired. I'm not saying it's a must. I'm just saying from my experience, these are the things that can be helpful. If you have someone who can show up to be a support for your child, and the school personnel get to know this is a child that people are showing up here on this school for this particular child. Also, collaboration. Remember, you don't have to go it alone. If you are experiencing certain challenges with a school, with your child, chances are there are other parents who are experiencing some similar challenges. So, when advocating for your child, you can approach conversations with a more collaborative mindset. You can potentially bring other parents in. Oftentimes, schools or school districts will have parent advocates, both in formal roles and sometimes in informal roles. And trust me on this one, when your child's school has a parent advocate, everybody knows who that parent advocate is because they are loud and proud. They are outspoken. And so you get to decide, is that a person that you want to reach out to or develop a relationship with to help support you in whatever it is that your child needs in that school? So collaboration with other parents can really go a long way. And that collaboration can also turn to, and I've seen it turn into real friendships and relationships where parents support each other with each other's children. If that is something that is a need of yours, if that's something that would be beneficial to you, then yes, whatever you can do to foster relationships with other parents where you all can support each other, okay, that can go a long way for both the parents and for the children that are involved. And so that relates to, how do parents cultivate a support network? A support network might be involving other parents, other BIPOC parents, but also sometimes issues come up and arise in schools where it's bigger than that. It's bigger than what any parent can do at any particular school or school district. So sometimes parents need to seek out advocacy organizations. There are some organizations that are located or rooted in schools, like I said before, such as parent-teacher associations or parent-teacher-student associations. There are oftentimes other local grassroots organizations or groups that can offer resources or workshops, support for families. These are different organizations that their role, their job is to advocate for educational equity. These are things that can be Googled. You can look locally. You can also look nationally to see who's doing this kind of work. And if they have a support line, you can call them and ask for advocacy for your particular child or your particular school, whatever the challenges might be. Okay. I'm here now in the state of Massachusetts, and in the state of Massachusetts, the school district has a parent stress line. That parent stress line is invaluable. So parents know, because it's advertised on the school district's website, that if you are having some difficulty, you can call and contact this number for parental stress. Okay. Some other things I'm going to go over have to do with, how do you prioritize as a parent your own social and emotional wellness? As they say, you cannot fill a bucket, your child's bucket, if your bucket is empty. So because in this particular talk, we're talking about BIPOC families, BIPOC children, we have to be able to understand the long-term and short-term effects of being on the receiving end of systemic racism. As parents, we experience it, children experience it. The thing is, parents who are older, wiser, more mature, have opportunity to be able to teach their children ways of coping and ways of surviving the impacts of this systemic racism. So being able to be a parent where you can have those kinds of conversations with your children, how you can prepare them little by little, how to navigate these systems that are very, very complex and not designed for our unique needs. As we know, BIPOC adults face a lot in this world, and BIPOC children do as well. They oftentimes face discrimination. They're dealing with microaggressions at school. They're dealing with cultural insensitivities. They're being forced to learn curriculum that does not reflect who they are or where they come from. And all of these things can really, over time, impact their self-esteem and ultimately their academic performance. It can also impact their mental and emotional well-being. So as a BIPOC parent, it can be very helpful to talk to your children on a regular basis about how they're feeling in school. How are they feeling about themselves? Do they feel seen? Do they feel safe? Do they feel valued? Do they feel understood? Do they feel heard when they speak? Because these are the things that are going to make a world of difference. If they can feel safe and seen and heard and validated, then it's more likely than not that they're going to be able to feel more connected and more engaged in the school, and that will reflect in their performance. Having open communication with the children, which means encouraging your child to talk about their experiences at school, both at school and as well as being at home. How supported do they feel being able to come to you as a safe space for them to discuss any challenges they might be facing, how they can work with other students, how they can work and develop their own relationships with school staff, how they can deal with any bullying that comes up, any acts of discrimination that occur. What does a child do? Okay. And if they don't know what to do, can they come to you as their parent and as a resource to find out what to do? What can be done? One of the things that we know for sure is that bullying at school is a huge issue for kids. And children get bullied for many, many different reasons, but particularly when students are bullied for who they are, their identities, it cuts even deeper. We know that bullying at schools is dangerous for children. And so if you suspect that your child is being bullied, if you report that bullying or your child reports being bullied at school and the school is not responding, it is very important that you reach out to any of the anti-bullying organizations and resources available in either your school district or, again, at the national level to be able to get involved, because bullying for children has very, very serious consequences, both academically, mentally, emotionally, and socially. Okay. Also, you can think about, depending upon, time, energy, and resources as a parent, what, if anything, can you do to advocate for BIPOC sensitive and culturally relevant education? Again, we're in a very critical time right now, so this is not necessarily going to be available to everyone, but there are still teachers and there are still schools who want to be able to represent, who want to be able to have inclusivity and representation taught in the classroom. And so if those teachers are around at your child's school, find them, reach out to them. And even if they're not able to do it on campus, they may be able to offer you resources, books, clubs, groups, things like that you can then go and find to be able to incorporate into your child's education at home if they cannot be inclusive and included in the child's educational experience at school. You can also join with parents who are also invested in culturally inclusive education. Advocacy, especially right now, it can be very, very, very important, where BIPOC families are coming together. If things are not going to be taught in schools, then they can certainly be taught outside of schools. And so getting the resources that you might need, even if it's, say, you put together a reading club. And so different families might be able to host book reading, right? To be able to help groups of children learn together. That's another opportunity. Again, for parents who have the ability to do this, who have the time to do this, advocacy at the policy level can also be very, very helpful. So not only is about being involved in school and being involved in district decision making, but when we're talking about policies, we're talking about the different laws. We're talking about all of the things that are sort of being wrapped around a school or a school district that helps this district run, that are making the decisions of what gets taught, that are making decisions around school discipline, suspension, all of those things, right? Getting involved in that level, having a parent voice is extremely important. And again, you don't have to do that alone. Oftentimes, there are many groups of parents who are advocating for the same things. Groups of parents advocating for the same things brings power to the issue. A lot of schools and school districts have school district meetings where the board can be there, the Board of Education can be there, listening to people who can sign up, who want to lend their voice. They are invested in the process of their child's education. Okay? That can be you, that can be a parent group, it can also be partnering with a community organization. There are many advocacy groups. They offer tools, they can offer supportive resources, they can help parents navigate these systemic barriers and to help address issues like inequitable school discipline practices or, a lack of resources. We still have situations where children don't have computers, there aren't enough books. There can be disproportionate suspension rates, particularly impacting BIPOC students. So that's another avenue where parents can get involved. Okay. I also want to go to a couple more things, and a lot of this has to do with how parents help support their children from home, things that parents can do. So we're talking about navigating systems, and particularly around parenting BIPOC children. But part of that as well is remembering that as parents, our children are always, always watching us. What are we modeling for them? Are we modeling? How do we advocate for ourselves as the adults? Life isn't easy for adults either, right? Particularly BIPOC adults. So our children are watching us. When we are encountering struggles, when we are encountering roadblocks, when we are frustrated with these systems, our children get to hear us and watch how we navigate these systems for ourselves. So model that, model advocacy, model empowerment, model how you can advocate for yourself. Model being able to identify what your needs are, what your child's needs are. Model being able to, in teaching your children to be able to speak up for themselves. How can they advocate for their needs? How can they identify what their challenges are? And if it's helpful, you can role play different situations with your children. Role play, a child might have some anxiety about talking to a teacher about something that happened in the classroom. You can play the role of the teacher and practice again and again, having your child practice bringing up the issue to the teacher. Helping your child feel empowered, helping your child feel equipped to express themselves. These skills are going to go a long way as they continue to get older and deal with life challenges. This is also helpful in being able to help your child create and develop some self-confidence. How do you build self-confidence in your child? How do you build self-esteem in your child? Well, one of those is really being able to teach them that their voices are important, that they are valuable, and that they are worthy of getting the attention that they deserve to have, getting their needs met, even in the face of adversity. So you can support them with those kinds of things and really being able to demonstrate and model what does it mean to be able to show up with self-confidence and being able to have the skills for advocacy to help them navigate these systems so that they can ultimately and eventually get their own needs met. Okay, so just a little overview of some key strategies, just an overview of some key strategies. One is, if you're going to get involved with trying to navigate a system, it can be very important and sometimes necessary to research the social system that you are trying to engage with. Okay? Sometimes it could be helpful to go far back and research the organization's history, get to know what are the dynamics, get to know who are the key stakeholders involved with this organization, what are relevant rules, laws, policies, regulations, so that by the time you step forward in your own way of trying to navigate this system, you have educated yourself and informed yourself of who and what you are dealing with in trying to do so. It is also important to remember that when, as parents, oftentimes when we're trying to advocate, we can get a little warm, a little hot under the collar, especially when someone is messing with our child, okay? Nobody wants that. And that is just real. That is just real, that is just true, and that is very understandable. That being said, it can be very important to remember to still do some active listening. How do we listen so that we can take in whatever resources or supports the people that we're dealing with are trying to share with us? We want to be able to pay close attention to diverse viewpoints and perspectives. We can actively seek to understand these different experiences and motivations within the systems we're dealing with, while still remaining focused on what it is that we are trying to accomplish and achieve for our particular situation or for our child. It can also help when you are dealing with these systems if you find people that are helpful. Write them down. Get people's names, get people's telephone numbers so that if you have a problem in the future, you can reach out to that person directly. If you encounter people who are absolutely not helpful, you can write those names down and write down those phone numbers, because no need to go down that pathway any longer. So it's about being strategic at times. Again, developing relationships that can be helpful to you and helpful to your child. And if possible, going around the people and the relationships that you find are not helpful, and maybe even going above to be able to speak to someone above that person who might be able to help you, or at least help connect you to a resource that can be helpful. Okay? This is called identifying the key influencers. Within any system, there are people that hold power. And it's important to remember that sometimes the people with the big fancy titles are not always the people that hold the most power. Okay? There is power that gets distributed across organizations in different ways. I can't tell you how many times that I've gone to advocate for my children at their schools. On paper, the school leader or the principal is the one on the top of the chain, but the person who is running it is somebody in the front office who might even be a clerical person who is running the show at that school. Work with that person. Find the people who are in power. Find the people who are willing to listen. Find the helpers. Find the people who want to work with you to get a problem resolved. Okay? Those are the people that you want to be able to work with. And if you don't know who they are, catch some parents on the side and ask their experiences, particularly if they have children that are older, they've been around for longer, they probably know who are the people to refer you to be able to help you get your needs met. Another thing that can be very helpful in these situations is document, document, document. If you have an encounter with a higher up person, school leader, principal, even teacher, just jot down some notes for later for the just in case. You never know when you might need to refer to a name, to a phone number, to a person who told you something. Just jot it down. I always recommend to the parents I work with, for every child, keep a child binder. Okay? Whether it's medical system, school system, mental health system, whatever the systems are, you have one binder for every child, so that when you are looking for something, it's right there in that child's binder. Keeps you organized, being able to find the information quickly that you are looking for. And any other information that gets added along the way, you just add a second binder if binder number one gets too full. That will help you, I promise you. When it comes down to knowing something or needing to know something, you don't have to reinvent the wheel. You just go to the binder, and somewhere amongst those papers, you will have the information that you need. Okay? I am going to stop for now, but before I end, I just want to say, and just acknowledge, that navigating systems can be overwhelming, it can be oppressive, and it requires intentionality. You have to know what it is that you're looking for. And so in order to find that out, though, you might need some advocacy, you might need some support from the system itself, from other parents and families, and maybe even from the larger community. But by understanding your rights, understanding the rights of your children, building relationships with schools, seeking out resources, being able to advocate for your child's needs, you can become empowered and you can teach your children that they can become empowered to advocate for themselves, to seek support from others, even in the face of adversity. It is also essential to hold schools and policymakers accountable for creating environments that will honor and uplift BIPOC students. That is their charge. And through this collective effort, we can work together, ultimately, toward greater equity and greater support, because all we want is to be able to help BIPOC children achieve their fullest potential. Thank you very much for listening.
Thank you, Nicole. That was fantastic. Fantastic information. I actually have a question. I know that there's some questions, but this is something a question that I thought about as you were speaking. And living in Atlanta, Georgia, we deal with a lot of refugees who speak other languages and a very high population of Latinos as well. One of the things that I've run into with some parents is, especially around school, is there's a lot of counties, and some counties really don't know how to really support, the BIPOC families. But one of the issues that I run into is, how do we work with parents, as I'm talking mainly the Latino families, because that's who has brought up the issues to me, deal with empowering. How do we empower them to be advocates for their kids if they're afraid due to their status in this country? Because they feel that if they advocate, that something could happen. They want to protect their status, especially if they're undocumented or something, like, because we see that a lot in the hospitals, and they tend to want to advocate, but they're afraid to because of their status. I'm not sure if have any info or any ideas how to work with these parents.
Yeah, what you are bringing up, Lakeisha, is huge. I mean, it's always been huge, but it's even more huge right now. And the unfortunate reality is that the fears that these parents have are real. They're absolutely real. And so we cannot argue with what is real, with not just with these families, but with any families. When you're talking about prioritization of needs and what parents are going through, particularly undocumented parents, I mean, the greatest fear, right, is to be deported. And with what we've been hearing is that people who are actually documented are still being, they're being collected up and at risk of deportation. I mean, the things that are happening right now are absolutely terrifying. And we don't know yet where this is going. Where is this going to lead? But what I do know, and when I worked for a school district in California, we had plans. I was fortunate to work for a very large school district that had a social services area where there were social workers placed in schools, and there was a district level social work. Not every school district has that. I don't know if that exists where you are. But what we would do with families that were at risk like this is we would put together a deportation support plan so that parents and the children would already have a plan in place for the just in case. I can't tell you how many times that we ended up having to call social services because elementary school children walked home after school and nobody was there because their parents had gotten deported during the day. Luckily, they turned right back around and went back to school because they didn't have any place to go. The doors were locked and the parents were gone. So being able to have a proactive plan is not only usable, but it also, in the state of terror that so many people are in right now, helps undocumented parents be able to develop a plan. If they don't even want to sit with you to be able to do it, or sit with anyone, you can give them the paperwork in their particular language. And I think it's translated in at least 5 languages so that they can develop a plan of action for the just in case. There is probably no parent right, that if they are legitimately feeling like they are at risk of deportation, that is going to become, as it should be, the number one priority. Because if you were picked up and you were gone, you cannot help your children, number one. And number two, your children are going to be worse off anyway. So it has to be safety, safety, safety first. Safety first. And if there is a child that has needs, that has parents that are undocumented, then part of it might be, and this is what we did, is how can parents, so oftentimes parents know people. They're not necessarily undocumented, and the only people they know are undocumented people. If there's anyone, if it's a mixed status household, for example, sometimes in the mixed status households, it is the people who are documented who need to be the ones to be able to step forward to do the advocating. They might not be able to sign the forms legally, but they can at least do some advocacy on behalf of the child that the parent themselves might not be able to do or might be too afraid to do because of the legitimate risk of being picked up. So it's very, very tricky and very, very sad. And, I think for right now, the truth is a lot of people everywhere have no idea what to do. And that's just real. We're in very, very critical times right now.
Yep. Thank you for that, Nicole. Thank you. But you're absolutely right. We don't know. It's just so unstable right now. You're absolutely right. Absolutely. Thank you for that.
Sure.
I have a question too, Nicole, and also I just want to thank you for this. This is so important. I feel like many people who are watching now or watch it later are just getting so much knowledge from you, and their tool belt, which was probably pretty empty when they logged into this, is full now with many options. And I really love that talking about having a plan, and having the binder. Those are things that you can have control of, and
Right.
helps you sort of ground you going to these really hard situations with your children. So thank you for all. And just that so many people also talk about these topics, but you've experienced these things, you've lived it, you're a parent, and that means so much, hearing your information and hearing what you can do to help and support. So thank you for that. I just had to say that first.
Oh, thank you, Victor. You're very welcome.
But my question is if you're a parent and your partner is not on board with this, right? You really want to move with your child and get them help in schools, and let's say your partner probably isn't even living in the home, possibly, but they're also the child's guardian as well. And so what do you do when they don't feel like they're just they'll be fine, they'll grow out of it? We don't believe in mental health in our home, we're Black. How do you navigate that one? Because that's hard.
That is hard, hard, hard. So one of the things that you're bringing up, and thank you for that question, because I have dealt with that question, and it gets very, very, very tricky. And it also depends on the state in which you are living. So in certain states, obviously, I don't know the laws and policies of all the states, of every state. But being in California, once a child reaches the age of 12, they can actually seek out mental health services on their own. They don't even need parental consent. That is not the case for everyone. And it does get tricky because, of course, a 12-year-old does not usually have a job to pay for those mental health services. So there is complexity there, right? There's also what you're talking about are custody issues. What happens when, there's some children that go back and forth, back and forth, back and forth. And so they may not even be around to be able to participate in therapy services because these next 2 weeks, they're over at this parent's house, and 2 weeks they're over at that parent's house, depending upon whatever the custody agreement. You're also talking about what is this particular BIPOC family's interpretation of what it means to need mental health services. In some BIPOC families, there is not even a thing called mental health. It doesn't exist. It's not a thing. And in some families, mental health equals crazy. And there's a lot of stereotypes around that. And my child's not crazy, so my child doesn't need counseling. There are so many, many different values and belief systems. And so in our roles, we have to really both hold the respect of the culture, hold the respect of the parents, hold the needs of the child per our assessment and understanding, and try to do a lot of what's called psychoeducation of helping parents understand the difference between a child that's just going through a rough time versus a child that might really be and truly be experiencing a mental health condition, an onset of a mental health condition, or the onset of a mental health crisis. Most parents that I've worked with, once it gets explained to them, they're not necessarily happy about it, right? They're not happy about it. But because parents typically love their children and want what's best for their children, even if they have a different way of conceptualizing or thinking about the child's behavior, we have to be able to hold that parent's perception of their child, because the truth is they will always know their child better than we do. And it's being respectful of that parent and their culture. It's working with them and collaborating with them to help us understand their perspective of their child, and also massaging that relationship with the parent to see, can we get them to be open to our perspective of their child? And then it hopefully, this is again, I'm talking about the ideal. Ideally, it can become a collaborative relationship that we're not trying to be dangerous. The things that we're talking about might sound completely bizarre to the parent and make no sense. We're not trying to stigmatize their child, but we also understand in so many cultures, mental health is stigmatized. If you have a mental health diagnosis, if you have a mental health condition, in some cultures, it's easier to view your child through the lens of this is a bad kid rather than this is a child with a mental illness. Because if you believe as a parent that your child is just a bad kid, well, you can do some things to get your kid to act right. That's not the same as having a child who is struggling with a mental health condition. In those situations, the same way or similar way that a child might be behaving in certain ways because they have a physical health condition, parenting them and disciplining them is not going to solve that. It's not going to change it. They need a doctor. For children with mental health conditions, they might need a doctor. They might also need a therapist. They might also need a group. They might also need all sorts of resources that only an assessment, a thorough assessment, can determine. But we also have to be mindful of the cultural differences. And across cultures, right, there is not necessarily an acknowledgement or a value for the more traditional psychotherapies that we're used to here in the United States. And sometimes we just have to honor that. We can do the best we can to try to help parents, understand it from our perspective, but we also have to be able to join with them and understand things from their perspective.
So true. Because of time, we're going to have to wrap up. But Nicole, this has been incredible. Thank you so
Same.
much for all your knowledge. And I know people will be rewatching this over and over again. Lots of info that they actually need in this crisis of a time that we're living in around mental health and around immigration and all kinds of things. So thank you.
Huge right now. It's so huge.
So I'm gonna just jump right in and talk about what bryt offers. If you enjoyed this session, we have these monthly, and they're different topics. But the first Tuesday of the month, we have these. The second Tuesday of the month, we have every Tuesday, we have from 7 o'clock Eastern Standard Time. We have support groups around this topic, and parents can log in and discuss and connect and be together. But we have basically the first week, we always have elementary school parents. So we sort of break it up. And then for the third week, we have conversations with high school and middle school parents. And then the fourth week, we have a BIPOC affinity group. So just for parents to get to connect and connected. And as Nicole said, it's good to stay connected. It's good to have these conversations with each other and use each other as resources. So I want to thank you again, Nicole. It's been great. And I hope people will join us in our support groups and our parent conversations. And I hope people will watch this and get lots of knowledge. Thank you so much for coming.
Thank you. Thank you all so much.